Well, the first thing I would say is to not be afraid or feel like you're alone. Again, there's so many people who suffer from PTSD, from various traumatic experiences that the person who suffers could be as close as your next door and you not know. It could be someone who's in your own house and you not know.
Hey everybody, this is Greg Washington and welcome to Guards Down. I have with me today Ralisha. How are you doing?
I'm well. How are you?
I'm doing good. Well, look, give our audience, tell us a little something about yourself.
My name is Ralisha Mercer. I am from a small little county in North Carolina called Currituck County. Small little city, Moyock, close to Virginia, if you've ever been in the Hampton Roads area. I am one of two on my mother's side. My mom has two daughters. My father's side, I have two brothers. Pretty big family. Kind of grew up we call it on the farm with a lot of aunts, uncles, grandparents, and cousins, and came to Greensboro a few years ago for a job opportunity and have kind of enjoyed myself. It's a big extension of home. I've gotten to meet a lot of great people and I've had some pretty good experiences while I've been here.
Awesome. Tell us a little more about your profession. What do you do?
Well, I am in charge of fundraising at North Carolina A&T State University. I have been there for about 4 years, enjoying the opportunity to raise money to support students, scholarships, professorships, and programs at the university. And I have been a student in the Master of Counseling program for a few years at Grand Canyon University.
Okay. Well, ladies and gentlemen, she's way more of a professional than I am. So I appreciate you coming on today and talking. Really want to dive into it. With this podcast, I want to talk about, ask the question of, should we talk about PTSD and complex grief? Or should we just, kind of push it under the rug like most folks do, right? Put a Band-Aid over it, put it in a box and put it on the shelf and out of sight, out of mind.
I think it's important to talk about all feelings, but particularly PTSD and complex grief. I think many people don't understand what it is, and they don't understand how to recognize it. They don't understand what different positions can bring across or bring about these types of clinical diagnoses, and they don't understand how to deal with it. They don't understand how to help their families and friends deal with it. And so I think it's absolutely important that we have the conversation.
Yeah. Okay. So to have that conversation, so someone like me who has been deployed, been through a number of series of trauma and grief, has now just put a Band-Aid over it. What would you say to someone like me who has lived with it, probably in an unhealthy way at some times, but now seeking to, to get help? So for someone like me, like, would it be better or worse, to talk about it? Because it's like when you speak on it, in a sense, you relive that trauma.
So that's a good question. And I think that that's a question that I myself have asked, not just about PTSD and complex grief, but any type of trauma. When you're dealing with trauma, and you speak with maybe a counselor or some friends about the drama, people tend to want to get down to the details. They ask you specific questions about the trauma, what happened, and you often feel as though you will relive the situation by explaining to the next person, why you feel the way you feel, or why you're so tormented. I don't think that it's necessary for you to, I think, explain every detail, but I do think it's necessary to talk about how you feel. So those are two different things. Explaining the detail that would allow you to relive the trauma that you went through only, I think, gives the other person more of an audience, or gives them more, I guess, of an understanding is a better word. It gives them more of an understanding of what you've been through. They're seeking to understand you so that they may help you. But I don't know that I agree that it's always necessary. I think you can have the conversation with yourself, whether you're journaling what you went through or you're journaling your feelings about what you went through. I think talking about how you felt as a result of your trauma is important, because the more you say it is almost like a release. You're letting go of the fear, and you are no longer giving power to that thing that would have consumed you before.
I like that. Okay, that gives some really good insight. Um, so there are treatment options that are out there that you necessarily don't have to what they call the exposure treatment, right? Where you have to speak on everything and relive it. Let's talk about like some of the different treatments that are available.
Oh my. So there's so many different treatments for counseling with trauma anyway. So you probably could apply. You have like experiential theory. You have a narrative type of therapy, CPT, CBD. Um, and I think you will find that many counselors will probably draw from the types of therapies that they're comfortable with, and those therapeutic modalities that they're comfortable with. I like CBD, um, um, and I think probably narrative therapy, maybe art therapy or music therapy also. But CBD, which is cognitive behavioral therapy, it doesn't go back and ask you to relive the trauma that you've been through. It really targets the symptoms. So if for a person who has PTSD, if you have a trigger, let's say a relationship, you're in a relationship and your trigger is a your significant other has a lot of female friends, and you have a trigger within that says, okay, when they start having a good time or doing a lot of talking, or he seems drawn to that person, that makes me afraid. CBD would look at the tactics, the behaviors that you may display when you're in that situation, and talk about pausing and how you can reset. So when you feel this way, you make a promise and a pact with yourself that you will exercise these positive behaviors to replace the negative behaviors that you would have displayed previously.
Okay,
And
that
I like it because, again, it doesn't force you to focus on the things that may have brought the trauma to you or caused you to be or live or stay in that trauma, but it talks about how you can react differently to it. And your reacting differently to it, of course, begins to take the power away from those things that take you to that trauma stance.
okay. That brings up two very good points. One, you talked about learning new behaviors, and two, which I think everybody, kind of needs to talk about or address or understand, is the collateral damage of dealing with PTSD, you as an individual and also the people around you. What would you say about the collateral damage portion of it, and also, learning new behaviors to help yourself?
So again, we have to consider that oftentimes people who have PTSD, they don't recognize that they have PTSD. So the first, I guess, line of defense is always going to be information. It's always going to be, having these types of conversations to say, hey, this is what this looks like. It's not just people who have gone into the military, but even when it is, it may not display itself just as a person who's been at war. It can be applied to many different situations, and in many different types of relationship. It could be, a parent and child relationship, and you'd have to try to understand what that dynamic would look like for a person who has PTSD. For people who are around a person who has PTSD, I would definitely say that it takes a lot of patience, because again, when the person doesn't understand, why they may perceive the world the way they do, it's difficult to explain that to your loved ones. Why you why you have certain behavior, why you may be cautious, and why you may have different sleep patterns, why you may have certain beliefs about how you need to operate inside of the relationship that you have, why you have maybe so many safeguards. Some people may not understand that. And so I think for a person who has PTSD, it's very important for you to explain and have conversations again with the people that you love, so that they better understand your perspective. And sometimes, the perspective you have may not necessarily be tied to PTSD. It just may be your belief, but at least having those conversations can help the people who love you understand, okay, this point that you're making in this moment seems more serious than, some of the other things. Let's talk a little bit about why you feel that way, and what helped you shape that worldview. When you're talking to someone about, their values and their morals, you have to be understanding that people have different worldviews as well. So you're talking about a lot of pieces that kind of are swimming together to form the person and make them who they are. And when you're dealing with a person who has PTSD, some of those behaviors and some of the things that they share are as personal to them, because it becomes a part of their worldview. It becomes a part of how their brain interprets, how they move and how they think.
Correct. So like basically it becomes a survival tactic. So whatever trauma you went through and how you dealt with it becomes embedded in you as a survival tactic. And so like for the individual who has PTSD, it's definitely a humbling experience, right? Or someone has to be humble enough to be able to, one, go out and talk, to someone about it, and then two, to be able to receive, what's being shared. Because like you said, you someone with PTSD doesn't necessarily know it or know that they are showing, right, the signs of PTSD. So to be able to have a close friend or a loved one that knows you and your behavior, to kind of intervene, I mean, that makes a world of difference, right? And to anyone out there, if a veteran comes to you, and not just a veteran, but someone that has dealt with, a traumatic experience, what advice would you give them when someone comes to them for getting help?
Well, the first thing I would say is to not be afraid or feel like you're alone. Again, there's so many people who suffer from PTSD, from various traumatic experiences, that the person who suffers could be as close as your next door and you not know. It could be someone who's in your own house and you not know. So I would also say take some time to reach out to someone. Um, I would say a counselor or an advisor. If you have a spiritual advisor, a close friend, just to talk a little bit about your feelings. Again, I don't think it's necessary to recount the situation, but to talk through your feelings. But definitely a professional who can help provide you with some tools to cope as you kind of go about your day, because dealing with PTSD is a daily, for some people, it could be a 1 hour at a time kind of struggle. And so definitely make sure that you read about PTSD, that you try to take some of the tools and techniques offered through some of the different counseling modalities to help you cope with the symptoms. And then also a good network, a good support network is always a good tool to have. And so, make sure that your family and friends, those people who are closest to you, your significant other, also have to take time to learn a bit about PTSD. They actually see us when we can't see ourselves, right? And so having someone to help us understand what our triggers are, could, perhaps you don't know what sets you off, but having someone who can understand and watch and say, hey, I think you're having a moment, I think could be really helpful in changing the behavior and then changing the outcomes and the mindset toward PTSD.
Gotcha. Okay. And to the person that is that's observing, what advice would you give them as far as like approaching and helping someone?
So I would say be patient, be kind and not accusatory. Truly observe. Um, don't take the situation for granted, and make sure that you're available for your loved one when they need help. Sometimes it's just talking through. Sometimes a person with PTSD is sad and they don't understand why. PTSD does encompass some sadness. It does often encompass some levels of depression. And so if you see those things, I think taking a moment to, again, help your loved one understand when they're kind of going through a moment, and just listening to them talk about their feelings. So one thing I think is important to know about people who have PTSD, um, they often relive that trauma over and over again in their mind. They can take that trauma and apply it to a brand new situation because the feeling is the same. And so when you're looking for signs of PTSD, those might be some of the things that you look for. When your loved one is describing something that may have happened, 5 years ago, but they describe it as though it's happening in real time. They've not let go of the emotion of that event. And so, again, making sure that you're there to be a listening ear, but also not letting them stay there, right? Because I think part of the comfort for a person who has PTSD is to bond with the pain. The pain is familiar, and although we say we don't like to live in pain, it can easily become part of the identity for someone who has PTSD. So having conversations with them about the here and now, and how they've transitioned from the space they were in previously to where they are now can be very helpful.
That makes sense. Because you hit on a couple of points. The biggest one is for like a person like me. I'm not that touchy feely type, into my emotions, and so to be able to express myself is one thing, but to understand that I need to relearn certain behaviors or establish new behaviors um, is key. I know me and Jerome, we talk about, someone that can quit smoking cold turkey versus someone that has to kind of taper off slowly, right? So if you can give us your perspective on establishing new habits and, learn behaviors.
So learned behaviors are pretty difficult to unlearn. From my perspective, I read a book that says like 21 days you can break any habit. But when you think about how we're built and how our bodies retain information, even your body, now I'm not talking about your mind, but your body retains information. 21 days doesn't seem like it can get you past a whole lot. So I think kind of making the conscious effort to build into your routine, and starting with one thing and layering it. For instance, if we're friends and I understand that, you have PTSD, I may make it as your friend, as the support person, my conscious effort to, call you every Wednesday, or maybe we have, lunch once a month. That's me checking in on you. If I'm the person who has PTSD, and I need to make some commitments to myself as well, which is, when I feel myself walking into a space is going to make me uncomfortable, I tell myself a silly joke. I sing a song that changes my mood and my mindset towards walking into this space. Or how about, I bring a friend that would distract me, or something, someone that would liven the mood. Because what you don't want to do is go around avoiding places that are everyday places, that are common places. Now, if we're talking about a place, a house, or where a traumatic event occurred, my opinion, that's a little different. And I think that would be dependent upon the individual and how strongly they felt about being in those places. Some people need to go back in order to face the demon, if you will. Some people can't go back, and I'm not sure that I believe that that would be a necessary part of their recovery. The part that matters about the recovery is, having the person in a mentally strong space where they can talk about the trauma, if they chose to, without all the pain.
Hey guys, it's Jerome. Greg and I wanted to invite you to the community that we created for the whole Guards Down family on Facebook. Jump on Facebook or check the show notes for the Guards Down Facebook group. There you'll be able to find a community of folks who are committed to raising awareness about complex grief and PTSD. Look forward to chatting with you guys in the group. Now let's get back to the episode.
Okay. That makes absolutely perfect sense. That leads to like the next part, because you more than likely it's a very close friend or relationship that is going to identify and would need the help. I remember being in a situation, with my my now ex-wife, where I had shown like signs of like PTSD and aggression, and she was like, "Yo, you need to take your pills, like your medicine." For me, like, I didn't like being called out like that, but it was definitely needed. And so I look back and like, I really appreciate her for like stepping in and, like talking through. And it takes someone, being firm, but also loving at the same time to help. So for like any veteran out there, like, take it. You like they used to tell us in the military, take the ass chewing and keep moving. You gotta be able to take it and know that the folks around you that are supporting you, that they love you, right, and that they care. Because if they didn't care, they probably wouldn't do anything. So take the ass chewing and keep moving, right? Let's talk a little more about relationships and dealing with PTSD and complex grief, but let's shift it more towards the complex grief side, because I know from a relationship standpoint, you have two people that are, and I kind of use what Will Smith quoted, two people that are walking their own separate journeys together, right? And so talk about being supportive in dealing with complex grief and like the treatments and stuff that are there, right? Because it's a process that one has to go through in order to accept the fact that their life has forever changed now, right? Because you lose someone.
So let me jump back a little bit to what you were saying about the medication first. I know that people have reservations about taking medication, but what I think they need to understand is there are times, particularly when you're dealing with mental health issues, that your body no longer produces certain things that it used to produce that would allow your mind to talk to itself in certain ways. I'm speaking particularly about the synapses that are in the mind. Sometimes ours can be broken for whatever reason due to environment, biology, food. And so it's really important that people understand that the medication that your provider offers to you is a synthetic way of kind of allowing those chemicals in your mind, the synapses, to do what it's supposed to do originally. So it may not have the ability to do it anymore. It's almost as if, I don't know, like a pacemaker, to kind of help keep someone's heart on beat. Those medications kind of help the mind do what it needs to do, so that you don't have those ups and downs that you may have when you're dealing with PTSD or grief or depression even. And so it is very important to take the medication and to take it regularly, because when you don't take it regularly, that could be just as dangerous, if not more so, than not having it at all, because it can cause more spikes within your day, higher highs and lower lows, and which could really kind of set a person off to do something that it could be more dangerous to themselves, to the people they love, or to someone in the community. So taking the medication, it is important. There are constantly studies being done to talk about, other things that people can do in addition to taking medication. And there are times that you actually can come off of the medication when you introduce other treatment plans, such as, the behavioral therapies or the narrative therapies, art therapy, music therapy. All of these are helpful, but the intent is to allow you to be able to deal with the pain and learn new behaviors until you no longer need the medication.
I agree. You hit on a point earlier when you talked about going back, talking about like, the medication and like maybe it's like the things you eat and stuff like that, right? So the point that I wanted to kind of bring up or interject is around having a healthy lifestyle or establishing one where mental health, fitness, as well as a good diet is all a part of your healing process when it comes to PTSD and complex grief. And that you should have an active regimen when it comes to doing both. So you have to take the time to, build yourself up. So having a good diet and eating right, or taking out all of the bad things that you probably shouldn't, or, in moderation, along with, fitness and helping with your mental health. So you brought up a really good point with that I wanted to make sure we brought out. And so, like, the point is not to get off of your medication or to stop it, but to incorporate all of the other things that you can do to help, yourself and your body. Because you keep talking about the body. And a really good book that I read recently was called The Body Keeps the Score. And for me, like, reading that really helped because, one, learning and understanding what you're going through and being able to put a name to it or a definition helps you to be able to understand and come up with a game plan for, for how to get back on track, right? Because if you don't know what you're dealing with, how can you overcome it? So you brought up a really good point there.
That's correct, and I agree with you. Just to kind of underscore, as a counseling student, when I write a treatment plan for our coursework, the academic part, exercise is always involved. And even if the person is wheelchair bound, you want some sort of physical activity because not only is it, nice for you to be, physically in shape, but when your body is exercising in exercise mode, it releases chemicals from your brain that your brain needs to release, allows you to get in more oxygen, and it helps overall with the way you think. Many people are emotional eaters. I'm an emotional eater. I eat some ice cream with caramel, and I'm allergic to caramel, but it feels so good. It tastes so good, and it just makes you feel good because it's ice cream, right? There are certain foods that are calming to me. Just as when it gets cool, a lot of people like to eat soup. I love sweet tea. It's just calming. I think we have a lot of people who are emotional eaters, but I think what we need to understand, and I think what we're beginning to understand a little more since, I guess Netflix is, if you binge watch Netflix enough, you'll learn a lot about food and the things that we've been eating that we thought were food. And so, I've been telling my friends lately, watch what you eat, pay attention to where you shop. I shop the perimeter of the grocery store because everything that is really food that we're supposed to eat lies on the perimeter. That's your veggies, your meat, your milk, cheese, and eggs. All of that is on the perimeter. All the stuff on the inside, that's crap. And it's in a box, it's in a bag, it's in a can. We're not really supposed to be eating those things. A lot of the food that we eat plays a big part in how we think, how our body operates. And so here in Greensboro, there are what we call functional medicine doctors, and they really teach you how to eat to live. If any of your listeners are familiar with some of the teachings of Dr. Sebi, and I think, what's the gentleman's name that recently died? Oh my goodness. Oh.
Nipsey
Hussle made him, I guess, famous again. But if you remember back in the 90s, Magic Johnson having AIDS was a big thing. Now he doesn't even test positive for it. And so a lot of that had to do with the way he ate. And we see kids now who are being born with having a lot of challenges and a lot of disease. And a lot of that is coming from the food that we eat. The body has the ability to heal itself, and it has everything it needs to heal itself. It's what we put into it that makes a difference. And so if this is true for the body, it's also true for the mind. Be mindful of what you put into your body. That means what you eat. That means what you watch. That also means what you listen to. So be mindful.
That makes sense. Let's hit on how does one go about establishing new behaviors?
So when I write a plan, I try to incorporate the things that the patient is telling me that they are that they enjoy. So things that make them happy. If they like to dance, if they like music, try to incorporate some music therapy modalities. If they play an instrument, what that might look like is, hey, you're going to agree to play your guitar, 4 times a week for 30 minutes and talk about how you feel after. Write it in your journal. If you like to draw, that might be the same thing. If you like to write, maybe you write about, something off topic. Maybe you're writing a book and then you come back and you journal about it. The journaling part is important because it shows progression. It shows you kind of what your thoughts were when you started out, and over time, you'll start to see changes. And it's important for you to see that because that's how you know that it's working.
Okay. Okay. Having that part, right? Establishing behaviors, or establishing new habits or new learned behaviors, talking about it, journaling it, and practicing it is a big key. Moving into the grieving process of a person who has, been through traumatic or has lost someone close to them, where do people tend to get stuck at in the grieving process?
Oh my. So there are several stages in the grieving process, and there is no one plate. I think acceptance acceptance is really a big one. Because I think a lot of people stay in disbelief. They are shocked that it happened. It just, kind of turns everything upside down. The anger is another step. Is you need someone to blame. Whose fault is this? Why did this happen? Why did it happen now? Why did it happen to my person? And just kind of trying to come to terms with, that's a defining moment. Things are going to be forever different. And, not being ready to let the person go. And then still having no answers for, why it happened perhaps, or why it happened at the particular time it did. I think a lot of people kind of stay there because, you're not always going to get answers. You can't always have the answer.
Mm-hmm.
And, the person's not there to give it to you, and God might not whisper it to you. And so you don't get the closure that you feel like you would have needed in order to move on. And so those are, I think, and because you don't get that closure, of course, it drives the anger. You feel like somebody, this has got to be somebody's fault. Even if it's your loved one who's passed, some people are angry with them because depending on how they may have passed, you may feel like, well, they could have stayed around a little longer. They could have hung on. They could have called me. They could have reached out. They could have. And so your mind goes through, I guess, all of the things that you feel like the person could have done. But if it's an accident, maybe not. If someone took their life, of course not. But again, we just need someone to blame.
Understood. I know for myself personally, I found it very hard to share feelings and thoughts and memories with other people because I felt like every time that I would speak on them, that I lost a part of them, right? And it was a thing. And so for me, I wanted to remember them, but I also wanted to forget the pain, right? And so like drinking would be a thing. And so I remember early on, when I was out the military, how like, I would drink to numb the pain or drink to try and go to sleep. But I could never find, that answer or get to that level of acceptance until like I actually, identified and was like, all right, yeah, I am hurting for the person that, that I lost and that I need to do something different. Right. And so like what you speak on really hits home. And I would, tell anyone out there that it's okay to grieve, right? It's okay to be angry. It's okay to want to blame someone. It's all a part of life. Um, but you can't stay stuck there, right? When you're stuck, that's when other things, bad things start to happen. And so to seek help, to talk it out, to write it out, all of these different forms of therapy, it's out there. But you have to do something to keep yourself moving forward. Your mind can only think about one thing at a time, and you get to choose what those thoughts are that you think about. And so like, right, you just you bring home a really good point. And I know we both have some people very close to us that, that we both lost. And so like, this is one of those touchy subjects where like it just makes sense to talk about. And so I really appreciate, you speaking on it and all the information that you have, shared throughout this. I think it's it's been awesome. So I definitely want to be able to have you back on and talk again. We'll have some, some other topics to talk about, definitely going into like relationships and, lifestyle. But I wanted to just take the time now to sum it up and really, and however you want to do it, what advice, what encouragement would you give someone out there?
I would say, don't give up. Again, most times people can't tell you that it's PTSD, but they know something's wrong. Their family members may know that something is wrong. And, trying to get a handle of that by yourself can be very difficult. I think we have been taught to not speak on it from certain demographic populations. We've been taught to, be strong, tough it out, um, pull your pants up and just kind of get it done, wear your big girl panties or, put on your big guy pants or whatever. But that that's not the case. I don't think that we need to live like that, nor should we. When you talk about grieving and PTSD, we have the power to hurt other people. So it's not just about us, it's about the other people who are around us, who are also confused as we are, who are also looking for answers, who are also, ready to help us. And so I think, if you are struggling with something and you feel like you're just not right, not where you feel like you should be, you have challenges with things that you think you shouldn't be having challenges with mentally, then I think, it's worth the conversation. And I'd also say, if you know that you're already there, do make sure that you take a look at your lifestyle, pay attention to the things that you eat. Get rid of some of the sugar, definitely. Get rid of some of the carbs. The keto diet craze has been a craze because it really gets our bodies back to what we should be eating. And again, that's all of the stuff that's on the perimeter of the store that I spoke about a little earlier. Exercise, even if you're just walking, it allows your body to burn off some of the chemicals that your brain needs to get rid of, and allows you to take more oxygen into your body. And so you think a little differently. I notice a big difference when I'm exercising versus when I'm not. Just like in my everyday life, I feel better. I think I think faster. My thoughts are more fluid, and things come to me. At work, I just feel like I'm in a zone. And so definitely make sure that you eat right, you exercise. And again, for those who are looking for different types of activities to change their behavior, start with the things that you're passionate about. Start with the things that you love. If you're a gardener, go to your garden and plant flowers and pick weeds. Whatever those things are, I would maybe create a list of things that you could do, and start incorporating those things that make you happy into your everyday life. Maybe pick 2 or 3 a week, and just give yourself some time. I'm going to do this for 30 minutes a week, 30 minutes a day for a week or 2. I'm going to, incorporate other people if you feel like other people need to be involved in your activity. Maybe pick one person at a time, so that gives you a lot of people that you can do things with. And by all means, this information you can find online. You can just kind of do a Google search. You can look for cognitive behavioral therapy, that's CBD or CBT, excuse me. And there are a lot of different types of activities that they have online that you may be able to do. But my last point is journaling. Journaling is so very important. Again, not because so much that the writing will, bring about the change, but so that you can be able to see the documented change when you write, if that makes sense. So at the beginning of the treatment, you may not feel a lot of change, but as you continue to go through and do the activities to do the work, you'll tell a difference by what you're writing. You'll feel more open to loving other people. You may be able to back down some of your triggers on your own. But that, of course, with a guided counselor, can help move you to, I think, a better space if you are dealing with grief or PTSD.
Okay. Well, I appreciate that. And for all of you out there, stay focused and stay engaged. This is Greg and Ray. We are signing off, and we hope y'all have a good one.